thanks for asking us. We did a session on diagnostic criteria in MS and how the current criteria have evolved and how we see it evolving in the future. So it was an opportunity to kind of revise the current diagnostic criteria, so the McDonald 2017 diagnostic criteria, which rely on dissemination in space and time to diagnose multiple sclerosis. And we went through a few case studies demonstrating what other kind of evidence you need to demonstrate multiple sclerosis in a patient that presents with a typical kind of clinical episode. And then Gemma went on to talk about how the criteria are evolving, and potentially, particularly because Gemma's interest is in neuro-ophthalmology, so to involve the optic nerve as a site to demonstrate dissemination in space in the diagnostic criteria. We talked a little bit about how we want to diagnose MS as early as possible in the condition to allow early treatment, but also to maintain kind of specificity and accuracy of diagnosis. So I'm going to hand over to Gemma at this stage because she talked about use of the optic nerve and in its use in the diagnostic criteria.
Yes, thanks. So what I talked about was, so currently we mentioned the McDonald criteria. So to show dissemination in space, so that there are different patches of inflammation in different places in the brain and spine, they have to be lesions in 4 different places. So that's the spine, the bottom part of the brain called the brainstem, next to the fluid-filled ventricles in the space of periventricular lesions, all right up at the edge of the brain, what we call cortical or juxtacortical lesions. And you have to have lesions in 2 of those sites to diagnose MS. And what I talked about is it's a problem if you present with an optic neuritis. So that's a patch of inflammation in your optic nerve, which is quite a common presentation of MS. In fact, it's the most common presentation of MS, because the optic nerve is not included as a site for dissemination in space. So that puts you at a little bit of a disadvantage if you're presenting with an optic neuritis, because then you need to show lesions in 2 of the other sites, whereas if you're presented with a lesion in, say, your spinal cord, you just need them in 1 other site. So I think probably what's going to happen is the optic nerve is going to be added as a 5th site for dissemination in time, and there's sort of been work done showing that will improve what we call sensitivity, so picking up MS, but probably keep it still as accurate. So I think that's probably one thing that will come in the future and improve the criteria.